The integration of physician, outpatient, and inpatient services all on one campus is a dream come true and creates a true one-stop destination for all our patients.
Hi, I'm Jonathan Ruiz, Chairman of the Orange Regional Medical Center Foundation. As you can see, this expansion project will affect many lives in many ways. So many of you have helped make our hospital the really great place it is today, and I know you'll help us make it even better.
It's more than a job, it's my life. I bring the patients home with me in my heart and in my head, and the staff yell at me, go home, it's time to go home, but it's really a big part of my life to be an oncology nurse and to be working with this staff who are just phenomenal at what they do.
The nurses in the infusion center are wonderful. They make you feel like you're part of a family. You walk in and it's like, hi, how are you? And they do that for every patient. When I completed my therapy, they had a little party. Everyone gathered around, everyone's clapping for me. And it wasn't just for me. That's the way they treat everyone. It's a nice way to be treated. It's like being part of a family.
When you're getting, treatment, head and neck cancers, it's really hard. You can't swallow, you can't eat. So we motivate them with the bell. Like, okay, 10 more days, come on, you get to ring that bell. And it amazingly pushes people because it's a huge moment.
Your treatment is done and we are glad. Go out in the world and find the fun to be had. We wish you smiles and happy tears. Spend time with those you hold so dear. Come back with good news to show and tell. Now ring the heck out of that bell.
Thank you to everyone. You guys are just amazing people. Thank you.
I have no relation to Orange Regional, just as a patient, and I see the people that took care of me and how concerned they were and how they're still checking on me, and that it's very nice. And you don't get the cell numbers for doctors in the city. I had cell numbers I could call on a Sunday, and all that makes you feel a lot better, really. And their staff they have was amazing.
I think that we have all the technology and everything that we possibly need here. I think that you can get everything you want and need from the big city up here. I think the doctors are fantastic, and I think that you shouldn't have to travel anywhere to get the kind of care that you need here.
You know about cancer, and until someone in your immediate family has it, it was scary. And the whole family, my daughters and I, wanted to support Kyra as much as possible. Being local definitely made that easy, and Kyra was so positive through the whole experience. She was just incredibly strong, and part of that, I think, is because she was having treatment right here. She wasn't traveling far. We could go to her appointments with her. For our point of view, for our feeling like we were helping, we were able to help a lot more and be a lot more positive, and I think here it was a lot more positive. It's always better if you can stay close to home.
Thanks to the foundation, we actually now have 3D mammography or tomosynthesis in our breast center, and we're very excited to use it. It's the latest advance in breast imaging, and it's something that is an amazing thing to offer to the people in this community.
Well, I think it's wonderful that we're doing this. For me, it was difficult having to go to Goshen every day for my radiation treatment, but to have everything in one place, to me, it's some sort of a miracle.
A cancer center located in Orange County would be incredible. To be able to get the support, the surgeons, the care, the aftercare locally, which I don't have at this point. I travel an hour and a half with traffic, plus tolls and everything else, would be a tremendous relief.
Again, I think the convenience of being able to go to one place rather than have to go to 3 different offices to have imaging, to have radiation therapy, simulations, consultations, and treatments. I think having everything in one place will absolutely convenience them in the sense that they will feel very less torn having to go from office to office.
Being part of the Southwest Oncology Group, we can offer our patients the same exact trials they would get at any large center in the country. And so we're able to perform the trials here, which I think actually helps and even improves care, because as issues and complications pop up, we can handle them in their backyard rather than making them travel long distances and get seen by people who don't know them very well.
Being close to home, I think, really means everything when it comes to cancer care, because cancer is not one disease. It is many diseases. It is many side effects. It is many heartaches and many hardships. And to be near home, to be at home, to be receiving excellent treatment at home, right around the corner, is paramount to a successful outcome.
We treat, female, male, prostate, breast, lung, and it's not just treating the patient. We also have the families that we think about, and we have young children. That come with their parents, and it's hard to watch. So we treat, it's not just the patient we also treat their families.
I mean, my father was diagnosed with cancer, and he passed away about 6. I'm sorry, I'm prepared for that. But being on the other end of the spectrum, being a patient's relative, I was very confident about the care. I knew that he could get the same care here that he could anywhere else.
I think that it's wonderful that we're providing a place for these families and that we're really doing something, that they can appreciate. I've had countless conversations with my mom, and sometimes she's like, there's just nothing we can do, but provide the best care possible. So, you guys made me cry.
So we have like our Quiet at Night initiative. We have our initiative where we make sure that our patients are getting like really cute stuff like cards delivered to them, balloons delivered to them, anything that they may need. I mean, I can go on and on about the initiatives that we have here that all center around patient care.
Make my brown eyes, don't it make my brown eyes blue?
When you sing to a person as you're caring, it's getting them over the difficult parts, and it makes them feel good. It's like therapy in itself.
We not only want to be the center that students choose for their clerkships during their 3rd and 4th years of medical school. We not only want to be the center that graduated medical students who are now doctors choose for their residency programs in various areas. We want to be the center that our seasoned doctors that have been here for years choose for their continuing medical education.
I found a lot of people with a lot of integrity, a lot of people who are putting their best foot forward and their best effort to people who really care about medical education, who want the residents to succeed, who want the med students to succeed.
It's not just about where I work, it's about where my heart lies. And I think that if you're really truly committed, how could you not want to make that better? And that's the important thing that I think about when I decide where I'm going to put my donations and my money. And I believe wholeheartedly in our mission and our values, and that's why I contribute.
The future is orange.
And we need your support.
The future is orange.
And we need your support.
The future is orange, and we need your support.
Please join me in supporting the Future is Orange campaign. Gifts large and small are welcome, and many naming opportunities are available. Join me now and support The Future is Orange.